we will discuss Enhanced Liver Fibrosis Score, a helpful tool used to assess how much scarring or fibrosis is present in the liver, especially for people with chronic liver disease. This test can also help predict the risk of developing cirrhosis, which is the advanced stage of liver fibrosis. The ELF score works by measuring three substances in your blood: hyaluronic acid, Procollagen III N-terminal Peptide, Tissue Inhibitor of Metalloproteinases-1. These markers are connected to changes in the liver's structure as scarring develops. The test combines the level of these markers into a score, usually ranging from 0 to 10. The higher the score, the more severe the liver scarring. The ELF score is quite good at identifying people with advanced liver fibrosis or cirrhosis. Research shows it can be more accurate than some traditional liver tests, especially in conditions like non-alcoholic fatty liver disease, hepatitis C, and alcohol-related liver disease. Here's how to interpret the score. Below 7.7, low chance of significant fibrosis, meaning there's likely very little scarring in the liver. 7.7 to 9.8, moderate fibrosis. Some scarring is present. Above 9.8, high likelihood of advanced fibrosis or cirrhosis. Doctors often use the ELF score along with other tools like imaging tests, ultrasound, MRI, and clinical evaluations to get a full picture of your liver health. While the ELF score provides valuable information, it doesn't replace FibroScan, which is another test that looks at liver stiffness. FibroScan uses ultrasound to see how stiff or firm your liver tissue is, a direct sign of fibrosis. The ELF test looks more at the biological activity of fibrosis rather than the physical stiffness of the liver. That said, the ELF test can be especially helpful in situations where FibroScan may not work as well, like in people with high BMI, body mass index, or fluid buildup in the abdomen, like ascites. So these two tests often complement each other. In some cases, using both together can give a better overall assessment of liver health. In summary, the ELF score measures blood markers linked to liver scarring. It's a good predictor of advanced liver disease, particularly cirrhosis. A score above 9.8 usually means a high chance of cirrhosis. While it's not a replacement for a FibroScan, it can be a helpful additional tool, especially when imaging tests are harder to perform. If you are being monitored for liver disease, the ELF score might help your healthcare team track how your condition is progressing and decide if further treatment or closer follow-up is needed.